Hey gang, welcome back to Gloves Off. My name is David Rice. I'm the chief editor here at DentistryIQ with, as always,
Katrina Sanders, the dental line hygienist.
Friends, we are so glad you're back. We have a topic today that I think Katrina may be picking on me a little bit for, and it's probably well-deserved from a global standpoint in dentistry, and that's how to get your doc to purchase new equipment. I'm just going to go lie down and take a nap.
Yeah, just take a snoozer. I'll take care of this one. Okay.
Yeah.
I do want to acknowledge you because there are dentists out there that love gadgets and will happily buy the new piece of equipment, almost to their detriment, because there are doctors out there that just have equipment collecting dust on a shelf somewhere. So I do want to say kudos to the doctors out there who love to buy equipment and love to invest in their practice. We appreciate that. And if you're a hygienist or an assistant or a front office team member, working with a doctor who's like that, take the time to thank your doctor because truly it's so valuable. I'm very fortunate. I work in a practice where our doctors will buy us the new bells and whatever we need. And I want to be clear, we're going to talk about this throughout some of our segments as we start to talk about some of the disparities of how do you get a hygienist to work in your practice with this job shortage, hygienist shortage, job abundance, as we talked about in our last episode. Think about why are you struggling to get a hygienist to work in your practice? And is it the fact that they do want to be able to bring equipment into the practice, et cetera? So I think that's an important piece. Hygienists out there, how do you get your doctor to purchase equipment? The first thing I'll say is remember that doctor oftentimes is a practice owner as well. This was not something that I understood until I started my own business myself, that we think that they're bringing in all of this production and all of this income, but there's overhead. They, they have to
so this isn't really happening.
Yeah. It turns out it's not. Like, was it Scrooge McDuck, like diving into his like dollar bills and doing the backstroke? Like, no, it's typically not like that. And so anytime that you come to the doctor and it's like, I want to buy this piece of equipment, I think a lot of doctors, first thing they think is, how much is this going to cost me? And one thing that I want to remind you of, hygienists out there, you are a partner, you are a mid-level provider in the practice, albeit most of us are not practice owners, or most of us don't have like a shareholder component within the practice. But you run your own column of hygiene. That's your little mini business within the practice. When you are communicating with your doctor about bringing a new piece of equipment into the practice, remember that that's a business decision. So this isn't like you writing your list to Santa and saying, Mom, I want a pony. That's not how this is. You have to approach this as this is a business decision, and I'd like to have a dialogue with you about what that means. So from a business decision perspective, first of all, don't walk up to your doctor after they just spent 4 hours in the MB2 canal trying to fight, tooth number 30. That's their brain is not into like, sure, let's sit down and talk to my hygienist about this brand new piece of equipment she wants or he wants. Find the time when it's appropriate, when the doctor is ready to have that conversation. And oftentimes that's not in the middle of the day in between patients. So think about that. The other piece that I will share is that there are a lot of fears from doctors that if I bring a new piece of equipment into the practice, I'm not going to get the ROI, which for hygienists out there that didn't go to business school, I did not go to business school, but ROI stands for the return on investment, meaning if I'm going to purchase this equipment, am I going to see this return on the back end? Am I going to see money coming in? Is this going to financially benefit my practice? Or from a health perspective, is this going to health-wise benefit my practice? Will my patients be healthier? Will my patients enjoy this particular piece of equipment or their interaction with it? Will it somehow make my practice better so that I'm getting more referrals, so that I'm doing more high-dollar procedures? What is the benefit to this? And so sometimes that return on investment is more procedures. Doctor, I'd like this laser in the practice. And if we had, brought this laser in, this is how much more money we could be bringing into the practice. Sometimes it is, doctor, we're a boutique style practice. I think we need to find a better way to make dental x-rays comfortable for the patient. This is a piece of equipment that will make that more comfortable with the clientele that we're attracting. I do believe that this will provide a more positive experience. we need to be able to help the doctor understand the why. And I think the most important piece to all of this is have that true business conversation. I worked in a practice where the doctor refused to get me a laser. And finally, I said to him, doctor, I went through my hygiene production last month. And I looked at all of the quadrants of SRP that I did, as well as the UCR, or the usual and customary rate or fee for what laser treatment would be per quadrant. I also gathered all of my periodontal maintenance appointments and looked at what the UCR would be for laser bacterial reduction, for example. And I just gathered these numbers based on the assumption that 80% of patients would accept my treatment, which is not the case. 100% of patients accept my treatment. Thank you very much. But I said on the low end, let's just assume 80% of them will accept treatment. This is how much money I would have brought into the practice last month. And then I just got quiet. Because the reality is, if I care about this piece of equipment enough that I'm going to walk through this process and let the doctor know I'm on board with you and I want to have this business model conversation, I think that changes the dialogue. It changes the vernacular. And I think it helps dispel that fear that a lot of doctors have about, am I going to buy this equipment and is it just going to collect dust? Are patients going to decline the treatment? And so why did I even buy this equipment to begin with, et cetera? My question to you, David, is what are some of the doctors' fears? Like what gets in the way of doctors allowing us to purchase the equipment that we want?
We're horrible people. No, I'm kidding. That was my outside voice. So, I think it's so. I think honestly, generationally, if I'm a seasoned pro and I've been doing this, say, 30 years, I've probably lived through some technologies that came and went, and they just didn't turn out to be what they were supposed to be, what they were touted to be. If I'm a super green dentist and I'm really young, then I'm probably fearful of every penny I spend because I have this massive student debt. And then there's the chunk of the middle children dentist. And we behave like middle children, right? We just get in our own way. So we think, boy, I haven't needed it so far. So let's see if I can get here. And it just becomes habit. So I think you made me think of two really big things. First of all, hygienists know your numbers. Yeah. And your numbers included, you said that really brilliantly, is your close rate, right? So if 80% of your patients are saying yes, or 90% or 100%, unreal. And if your numbers are lower and you believe technology or a new purchase may help you increase your numbers, that could be a strength too. And then the other side of it is know what matters most to me. So you brought up a lot of different examples, things that related to money, appearance, time, trust, comfort, and health. And I promise you, one of those motivates your dentist. Yes. Knowing which one is the key. Because if I'm data-driven, talk to me about data. If I'm all about the health of our patients, nothing else matters to me. Then don't bring me your numbers. Right. Bring me healthy patients, better patient care. So understanding which one of those 6 drivers I value most will seal your deal like that.
I love that you said that. It's almost like, what is your dentist love language? I don't know if you've read that book by Gary Chapman, but that's what it is. And it's so funny because I think all hygienists assume right away, it's money. It's money. And I think, yes, you always need to, it's like when you decide you're going to buy a car, at some point, you're at the BMW dealership and they're writing up the order for your custom leather seats. At some point, you're going to be like, okay, how much is this going to cost me? Right. I mean, any reasonable person, unless you're like Elon Musk, any reasonable person is going to want to know at some point what the fee is. But to your point, I think we're so focused on the fact that all the doctor cares about is production. And I don't think that's necessarily the case. I think while doctors do care about that because they have to, we're running a business, I do think there's a large portion of our doctors out there that really do care about patients being happy, patients being comfortable, and patients being healthy. That's why we went into dentistry. So I love that. Talk to your doctor, identify what their motivator is. And you can use that to help them understand why you're a partner in this. It's so isolating being a business owner sometimes. That's why, doctors like having associates or, bringing somebody else on into the practice. Hygienists, I think a lot of doctors want to feel like their hygienist is a partner with them, that we're in this together. We're here with you. I want our patients to be happy. I want our patients to be healthy. I want our patients to have a wonderful experience when they're sitting in my chair or in your chair. The more that you can help your doctors understand that the reason why you're approaching them with this is because you want the same things they do. I think that helps create a better and more collaborative conversation.
I entirely agree. And, hygienists, don't forget that although your dentist is a business owner, odds are she or he had no business training.
No.
So they're as lost as the next person. And we really need your help.
Mm-hmm.
We need your leadership. We need your expertise. And when you come to us with, we're doing this together, that makes us feel really safe. Just like you want to feel safe, we do.
Yes.
We need that too. And that's a really great point, Katrina, is it gets lonely out there sometimes because we want to lead our team in the right direction. And there are days we just don't know if we're doing it or not. So when we pull together as a team and we communicate, like we've been talking about in each of these episodes, we get stronger together.
Yeah.
Any parting thoughts?
No, I love that. I just want to echo what you said. We are stronger when we are together. Have those conversations, come together as a team, share your ideas, share your thoughts, because your patients are counting on it.
Yeah. Friends, thanks for tuning in. How to get, people like me to buy all the right stuff for you. Tune in next time. We got more great info coming your way.